Good day, Professor. I'm Naso Muhammed, and today I'll be making a video on how to perform an oral pharyngeal suctioning. Before I start the procedure, I'll first confirm my physician's order, which is to perform an oral pharyngeal suctioning on this patient. After that, I will list out the equipment that are needed for this procedure. The equipment needed for this procedure are basically my Yankawa catheter, my suction tubing, my pulse oximeter, my stethoscope, my drape, toothpaste and toothbrush to perform oral care, gloves, clean gloves, mask, gown, or face shield, a Mrs. basin, and basin for water, and a normal saline right here. After I'm done listing out the equipment, I will be on my way to the patient room. I will knock on the patient door in order to ensure the patient privacy. When I get into the patient room, I will close the door behind, and now in order still to ensure the patient privacy. Before I approach the patient, I will perform hand hygiene by using my hand sanitizer. Now that I'm done performing the hand hygiene, I will approach the patient. Good day, ma'am. I'm Nurse Muhammad, and today I'm going to be a nurse. May I please? First and last name?
Lisa Wells.
Date of birth?
November 3rd, 1999.
Thank you. Now that I've verified the patient, I will explain the procedure to the patient. Ma'am, today I will be suctioning the secretion. I will be removing the secretion in your mouth so that you can be able to breathe well. Are you okay with this procedure?
Yes, go ahead.
Okay, thank you. Now that I've confirmed with the patient, I will apply my pulse oximeter in order to monitor the patient oxygen saturation level. When I'm done applying the pulse oximeter, I will put the patient in a comfortable sitting position, or I will place the patient in a semi-fallow position. Thank you. Now that I'm done placing the patient in the semi-fallow position, I will assess for signs that says the patient needs suctioning, such as drooliness, restlessness, ineffective coughing, and gargling. After that, I will apply the drape on the patient. After that, I will put on my gloves. I'll put on my gloves, my gown, my face shield, in order to prevent splashing. If splashing does occur, I will pour my normal saline into the basin, about 100 milliliter of normal saline into the basin. I will take my connecting tubing and I will connect it to the I will take my suctioning tubing and I will connect it to the suctioning machine. I will turn on the suctioning machine. I will take the other end of the suctioning tubing and I will connect it to the Yankawa catheter. Now that I'm done, I will suction a little amount of water to verify that the suctioning mechanism is working perfectly. Yeah, it's working perfectly. Now I will take the Yankawa catheter and I'll put it inside the patient's mouth. Okay, the catheter is in the patient's mouth. I will move the Yankawa catheter along the patient gum line towards the patient's pharynx. While I'm doing this, I will be doing this in order to clear all the secretion in the patient's mouth. Now that I'm done, I will take out the Yankawa catheter away from the patient's mouth and I will suction water through the catheter into the suctioning tubing in order to clear the suctioning tubing of all the secretion that are collected from the patient's mouth. When I'm done with that, I will take the suctioning tubing, I will remove it from the end of the Yankawa catheter. I will turn off the suctioning machine and I will fold the suctioning tubing into a plastic bag or into any bag to store in a cool dry place. and I will place it by the patient's side in order for another nurse to use it, or if there is any chance of suctioning the patient mouth again. Now that I'm done with that, I will take the patient drape and I will discard it in the emesis bin. When I'm done with that, I will give the patient a new drape or a towel to clean her mouth, and I will discard that in the bin too. When I'm done, I will perform oral hygiene for the patient. When I'm done with performing the oral hygiene for the patient, I will take out my glove. I will discard it. When I'm done discarding my glove, I will pour the normal saline water. I will pour it away. I will clear the patient room, and after I'm done with that, I will perform my hand hygiene by using my hand sanitizer or by washing my hand. When I'm done with that, I will go to the computer to document my findings. I will document the procedure, including how well the patient tolerated the procedure, and I will also note the suctioning amount, the color and odor of the secretion that I collected from the patient mouth. And that will be the end of my oropharyngeal suctioning. Thank you. With the professor, I'm Naso Muhammad, and today I'll be making a video on how to perform a nasopharyngeal suction. Before I start this procedure, I would first of all like to confirm my physician's order wishes to perform a nasopharyngeal suction on this patient, and after that, I will list out the equipment that needed for this procedure. The equipment needed for this procedure is basically a suctioning kit, a toothpaste and toothbrush to perform oral hygiene, a basin, a clean glove, a gown, a face shield, a mask, a hand sanitizer to perform an hand hygiene, a drape, pulse oximeter, a catheter, a stethoscope, a lubricant, a suction tubing, and a normal saline. I will go into the patient room. I will knock on the patient door to ensure the patient privacy, and I will close the door behind when I get into the patient room in order still to ensure the patient privacy. Before I approach the patient, I will perform my hand hygiene by using my hand sanitizer, and when I'm done, I will approach the patient. Good evening, I'm Naso Muhammad, and I'm going to be your nurse today. May I please? Can you please tell me your first and last name?
Lisa Wells.
Date of birth?
November 3rd, 1997.
Thank you. Now that I'm done confirming the patient's identity, I will explain the procedure to ma'am. Today, I will be suctioning your nose so that I can clear the secretion in your nose to your lungs in order for you to be able to breathe well. Are you okay with this procedure?
Yeah.
Thank you. Now that she's okay with the procedure, I will take my pulse oximeter and I will apply it on the patient in order to monitor the patient's oxygen saturation level. After that, I will place the patient in a comfortable sitting position or a semi-fallow position. Are you comfortable right now?
Yes.
Then, after that, I will take my suctioning tubing. I will connect it into the suctioning machine, and I will turn on the suctioning machine, and I will place the other end of the suctioning tubing by the patient's bedside. After that, I will take my drape and I will place it. If there is any drape available, I will place it over the patient's chest. I will take my suctioning kit. I will open my suctioning kit. I will take my normal saline and I will pour it into the basin compartment of the suctioning kit. I will take my lube and I will squeeze it, open it and squeeze it on the outer open surface of the suctioning kit. I will put on my gown, my face shield, my gown, and my gloves. If likely there is a splashing that occurs. I will put on the sterile glove that I got from the suctioning kit. After I'm done with that, I will carefully take the one-time use catheter. The one-time use catheter, I will take it and I will connect the other end of the suctioning tubing to the end of the catheter. I will set the suctioning machine to the lowest level. Then I will take the catheter and roll it over on the lubricant, on the water-soluble lubricant. And when I'm done with that, I will take it and be ready to put it inside the patient's nose. I will take the suctioning catheter and put it through one of the patient's nares. Now I will be suctioning the patient. Nares. The catheter is inside. I will be suctioning it, and now we take off my hand away from the vent. If I eat an occlusion on my way putting the catheter into the patient nares, that means I might have hit the carina. So I will roll it back about 1 to 2 centimeters before I apply suction again. The general rule used when performing nasopharyngeal in adults is to insert the catheter about 16 centimeters. In older children, insert it about 8 to 12 centimeters, and in infant, we should insert the catheter in about 4 to 7.5 centimeters. And this is an adult, so I have to insert in like 16 centimeters. When I'm done inserting it, I'm done with the suction, I will carefully remove the suction by rolling back and forth through the patient nares, and at the same time performing intermittent suctioning by placing my hand over the vent for about 15 seconds or less. And I will take out the catheter. I will take the catheter and now roll it over my hand. I will take out my glove and I will dispose it. After I'm done, I will take the drape off the patient's chest, and I will trash that too. I will get a new drape and give it to the patient in order to clean her face. I will put back the oxygen mask. When I'm done, I will dispose the suctioning kit. I will dispose it in the receptacle, and after that, I will perform oral hygiene for the patient. When I'm done performing the oral hygiene for the patient, I will perform hand hygiene by using my hand sanitizer or by washing my hand. And when I'm done, I will document. When I'm done, I will document the procedure by including how well the patient tolerated the procedure and the amount of secretion, and also the order of the secretion. And that will complete the end of my assessment on oropharyngeal suction. Thank you.